Okay, thank you for joining the menstrual cycle optimization training. My name is Nina Lemtier, and I'm a nutrition lifestyle strategist, extremely passionate about empowering women's womb wellness and overall wellness. And this evening, we will be really going into a bit more detail in regards to how you can optimize your cycle, because obviously it's whether you were shown when you were younger. I certainly wasn't. I was kind of left to figure it all out, and it's something that if you can really get more depth in regards to what works for you and principles that will really be quite significant, not just when you're on your period, but when you're off your period, how you feel when your period is going to start, and fertility, which is obviously a huge area um, for women, depending on what your goals are and yeah, what's actually happening for you. So over the next kind of 30-40 minutes, I'm going to go more into more detail. And yeah, if you've got any questions, feel free to use the chat box. I will check it at the end. Okay. So for those of you that don't know, I um, basically had to realized that I was miscarrying because of my fibroids. And my cycle notoriously was very irregular. And it was irregular for so many reasons. One of the main reasons was my diet and my lifestyle. And the fact that I had no kind of stress management plan in place, and I had no nutrition plan in place for the best part of my 20s. So my cycle would disappear for a few months, like I wouldn't have a cycle, or it was very all over the place. And it's interesting because when I had the myomectomy and had the big ones removed, I conceived quite easily over the next years since I'd done that, and I made lots of changes to shrink the ones that were left behind and mitigate adhesion formation, which is very problematic scar tissue. I've never had any complications during my pregnancies. I've never had any kind of inflammation that's caused pain and lots of difficulties, even conceiving. Like, I've just never had any issues. And what I attribute that to is because I was on a very strategic supplement plan before I conceived. This is really key because when I had the removal, what I was being told was really just nothing that was going to help me. It was actually scaring me. So I had to really look at what I could do to just change the statistics from what I was being told, which was, I had to quickly try and have a child, and I'd be lucky if I had one. The fibroids would grow back. I had a window that I had to utilize, all sorts. And it was quite scary at the time. So I went and I've made so many changes, and it really, really paid off. So don't overlook the power of your body's natural healing powers and capabilities, and obviously the power of nutrition and how you can support yourself in regards to fertility, and also obviously fibroid growth and having a happy cycle. So let's get into it. So what is it? What's the menstrual cycle? It really begins at puberty. Obviously, it's about preparing the body for pregnancy. It lasts around 28 days, but can be shorter or longer. And when it comes to young people, obviously, they're going to be just kind of starting out having their periods. So when you are kind of early on your cycle, this was an area again that I had no guidance in. My periods were extremely heavy. and it was all over the place, very painful. And what happens is
Yes, because they have to do with
dismissed
me.
as
Mm.
normal, and you almost get accustomed to heavy bleeding from a young age to be normal, and painful periods as well from a young age to be normal, and that is not right. You might experience pelvic pain, irregular cycles, and it will just be brushed off as puberty, changes. And what happens is birth control pills are prescribed very early on to stem bleeding. And what it does as well is it masks any kind of fibroid related issues. And nobody's really looking at that. Nobody's going into more depth. It's just kind of take these pills and be on your way. There's a serious lack of scans being offered. Um, there was a lady that I was watching on Alero's Instagram recently where it was probably about 5 years of horrible symptoms. Like she was just going back and forth with the doctors before she was offered a scan. And obviously, this is because scans aren't cheap and they don't want to offer it to you straight away. You have to really complain, which is really not ideal. And fibroid symptoms are frequently mistaken as for conditions like PCOS, endometriosis, and induced irregularities. So this is delaying proper diagnosis of fibroids and other womb conditions. Okay. So what you can do to prepare ahead of your menstruation. So what ideally you should be tracking, so using apps or whatever works for you. And about a week before you're due to start, you want to increase your calories. And this is because your body's going to be consuming more energy, obviously, because of this additional process that's going to start. So that's a great way to get ahead of the cravings, those notorious cravings that most women have that kind of indicate to them that their period is about to start. Now, to get ahead of that, increase your calories, obviously from a healthy source, and also increase your protein strategically. This is a great way to really prepare the body and stay ahead of what it requires for the process. And also staying hydrated, limiting salty and processed foods will minimize water retention. It will also minimize any inflammation and obviously everything else that comes with that process. So if you avoid salty processed foods, this will impact the negative symptoms if that's something that you experience, like pain, feeling extremely tired, and obviously very heavy flow. So on day one, the menstruation is the shedding of the uterine lining, lasts an average of 4 days. And this can be for a woman with fibroids or without fibroids, but particularly women with fibroids will experience, they tend to experience heavier, more prolonged bleeding. This bleeding stage can be more painful due to the hormonal imbalances and the increased uterine lining. I've met women that have had periods for weeks, 14 days, 20 days. It can be really, really excessive when fibroids are particularly intramural. It's really quite remarkable how much blood loss takes place. I used to experience flooding where it was like 2 liters of blood comes in one go and it just completely soils all my clothes. So it's not, really, it's very embarrassing if you're in the wrong place. And yeah, it will affect your confidence when you're on your period dramatically. So what can you do? What step can you take to mitigate this and to support your body and to really reduce those negative aspects? You can incorporate iron-rich foods, anti-inflammatory foods like spinach and berries, and this will help to reduce inflammation, replenish the iron that's being lost. Taking iron supplements if you are prone to extreme heavy bleeding, this is really important. And strategically supplementing is really key as well, especially if you're leading a very busy lifestyle. You work long hours, you find that most of the day, maybe you're not even getting a chance to eat. So this is where you really have to understand that simply not having anything is not it's not going to impact your cycles in a positive way, put it that way, because when there's deficiency, there will be overcompensation, and then there obviously is that deficiency in what the body needs, and that's going to impact the cellular health, and then obviously inflammation levels, and it's just a vicious cycle. So if you don't have a plan in place, it's important to have one, especially if you've got a high paced role, career, very demanding mentally, physically, and you find you're not able to eat nutrition dense meals. Okay, because if you don't, then what happens over the years, you'll develop chronic deficiencies that exacerbate obviously growths like fibroids and other complexities as well. So it's not, fibroids is just one condition that can cause obviously a lot of disruption, but there's other implications to chronic deficiencies as well. Now, day 5, after your menstruation, the uterine lining will begin to regrow and an egg matures in the ovary. Now, for women with fibroids, this phase involves excess tissue growth. And depending on how the tissue is growing, brings in things like endometriosis. Again, if you've had a surgery, then how the tissue has healed, it will impact, how this stage transpires. And what happens for some women is extreme discomfort and pain because of how it's growing and what that is doing in regards to blood vessels and things being pressured on, and it obviously can be quite complex. So it's important to note that the way you can reduce this is through your diet in regards to the pain and the inflammation, and it will make this process a lot more smooth, and you'll experience less discomfort and pain. And obviously the hormonal imbalances as well contributes to this process as well. So it's really looking at it in a multifaceted approach. So what can you actually do in this during this phase? So you can support your body by increasing your omegas. I do this personally, whether I'm on my period or not. I'll take a couple of tablespoons of extra virgin olive oil. This is a great way because I've reduced the animal protein consumption. This is a great way to get those key omegas in without having to eat, lots of fish that has lots of hormones and things like that. Obviously, there's great quality supplements as well that you should incorporate. But I wouldn't rely solely on just capsules and things. Obviously, your diet is important as well. Taking flax seeds, walnuts, this is a great source. And really just stay hydrated as much as possible, and also support how much toxins is being released through your skin through like perspiration. So exercise is really key. just going for walks, maybe increasing your pace so you don't have to go to the gym. But this will support this stage significantly because it will support the healthy tissue regeneration, and not just normal hydration. Make sure you've got electrolytes in there as well, because again, it's about replenishing those lost minerals, vitamins that are required daily. There are it's something like 70 plus vitamins, minerals that you need daily that your body doesn't store. So you also have to factor that in. And this will be really key to support this stage. It will reduce inflammation and make you feel a lot more balanced and yeah, relaxed. So day 14, during ovulation, a mature egg is released and travels towards the uterus. For women with fibroids, this phase may be exacerbated with bloating. So you might experience that your tummy is unusually swollen, pelvic pain, hormonal fluctuations. So again, everything that I've said on that latter slide, that's what will really support this stage immensely. Now, what you can do is incorporate magnesium-rich foods, take supplement as well, take more spinach, almonds to ease cramps. You can use a like a hot water bottle, and then also use castor oil packs. This is a good stage to use that, and it will support the hormonal stability during the ovulation stage. Do light stretches in the morning and before bed. Nothing intense, just to really relax. Do the stretch till it feels uncomfortable, and then it kind of feels comfortable. It's weird. The stretch kind of, if you do it long enough, it will feel uncomfortable, but then it will feel comfortable. So that's how long you should do it, in the morning and before you go to bed. And this will support circulation and muscle support. And if you can really build this as a habit, you should notice that your pain threshold increases, as in you won't feel the pain as much. So if you were having cramps, you're not having cramps as much. This will support that as well. So day 28, the cycle resets. If fertilization did not occur, then the uterine lining breaks down, leading to the menstruation and restarting the whole cycle again. Now, women with fibroids tend to experience heavier bleeding and discomfort. And this is something that some women may not have that, they may just see that there's a mass, they can feel a mass, but they actually don't have any issues with bleeding, like they don't have heavy bleeding. So it's not like every woman, but most women do tend to have heavier bleeds, and it's a very painful and discomfort stage. Now, again, what if you're wanting to conceive, or you're wanting to increase your chances of conception, then supporting the lining of the womb with exercise and supplements that encourage, kind of thicken the lining of the womb is very critical as well. And obviously supplements to support your ovaries and the number of eggs you're producing as well. This is key. And those supplements are like Q10, coenzyme Q10. Always get the high dose and the potency. Always go for the highest, because there's different levels. Okay, so the action step will be to support your body by drinking herbal teas like nettle and milk thistle, green tea, but be kind of limited because of the natural caffeine in the green tea. So be strategic with the times you take it, depending on your sensitivity to caffeine. This will help to tone the uterus down and reduce heavy bleeding naturally as well. So when fertilization does occur, when you have fibroids, now I had, fibroids during all my pregnancies, but the difference now is that they were shrinking, they were less dominant, and I was now like a powerhouse when it came to my supplements, my lifestyle. Everything had really shifted. So if you do have fibroids and you are really concerned with conceiving with the fibroids, just know that it's possible to have, a healthy pregnancy with fibroids, but it's just about reducing their dominance and obviously getting them shrinking and also improving your natural body balance to make sure that they're not growing and it's just the baby that's growing. Because when that's out of sync, and you haven't got the right plans in place, then there are cases where the fibroids grow faster than the baby. And one of my friends actually experienced that. And unfortunately, one of the fibroids ruptured when she gave birth, and it was so touch and go to stem the blood loss because it was a very big fibroid. And as you know, they've got a lot of blood coming to them, and it was very touch and go. But thank God she was okay and her baby was okay. But yeah, there are complications potentially, depending on how big they are, where they're positioned. And what will happen is you would just go for more scans, just to check everything's okay. So it's not something to worry about. Now, the fertilized egg implants into the uterine lining, marking the start of pregnancy. And you would just increase monitoring. So you'd go for more frequent scans. And if you're not being offered more frequent scans, make yourself known and make sure you kick up a fuss, because you should be having extra scans when you have fibroids and you're pregnant. So don't just go with the standard. Make sure you're getting extra scans and things are being kept, and things are being monitored. Now, fibroids can cause implantation issues and complications. Obviously, this just depends on where yours are positioned, their sizes. This varies from woman to woman, and it's important to obviously get clarity on where yours are positioned. And from a gynecologist, they will give you specific guidance on whether your fibroids can impact fertility or not. So work closely with your gynecologist, health provider to manage the fibroid related risks during pregnancy and ensure that, your uterine health is really optimized. You're eating nutrient rich, dense diet. You're using stress management techniques. You're really just taking it easy, not worrying. And in regards to supplements, you can't introduce anything new, unfortunately. If once you're pregnant, you just have to continue with whatever you're doing. But what you can do to prepare ahead of conceiving is get a really good plan in place, because whatever you're doing before conception, you can continue, obviously with guidance during pregnancy. But make sure you get guidance, because there might be some supplements that you can't continue with, but some that you can. But the rule of thumb is that whatever you're taking before you conceive is fine for during, but you can't introduce something new once you're pregnant. And as I said, optimizing your supplement strategy before you conceive is really, really key. Really key. This, I believe, is one of the most important factors once you want to keep your risk low during pregnancy, and obviously after pregnancy as well. So menopause. Now, menopause marks the natural end of menstruation and typically occurs around the age of 50. Again, that's a averaged age. Could be a bit less, could be a lot higher than that. Obviously, it's down to the individual woman. Now, when you have fibroids, menopause often brings a level of relief. This is because of the hormonal decline and decrease in estrogen. Okay, so what women can be told is that, oh, soon you're going to hit the menopause, so don't worry, don't worry about it because soon you're going to hit the menopause. But that, again, because you don't know when, and there's also a stage before that, which I'm going to go into, it's not a great guidance in regards to quality of life. Personally, I don't think that's helpful, but that's what a lot of women are told at a particular age if they do have problematic fibroids and symptoms. So the noted stages of menopause are, there is perimenopause. So perimenopause is often overlooked, and it's actually the transition phase before menopause. Okay, and it often can start in your 40s. Again, that's just an average. Now, hormone levels will fluctuate, causing irregular periods, hot flushes, mood swings, sleep disruption, and your fertility significantly declines. But conception is still possible. Okay. And that's why it will always be down to an individual, don't think because you're in your perimenopause you can't conceive, because it is still possible. Now, menopause officially begins 12 months when you haven't had a period. But, I've known women to not have periods because of other variables, and then they still have periods and actually conceive. So, again, this is just kind of like an average specified time. But what happens when menopause is officially kind of noted? The ovaries stop releasing eggs, and estrogen production decreases significantly. Symptoms like hot flushes and vaginal dryness may continue or worsen. Okay. And what you can do to transition really smoothly, again, is being proactive in regards to what your body needs to support, your hormonal balance, and you obviously your nutrition, diet, lifestyle, really get processes in place, get positive habits so that you're really supporting key transitions in the most optimized way. And this will allow a less kind of dependency on any hormonal intervention or any kind of medications and things like that, because obviously they come with side effects, and you really don't, you want to keep that to a minimal. And then post-menopause, the phase after menopause, where estrogen levels stabilize at a lower level and some symptoms ease, but risk to bone density due to that decline. And then also cardiovascular issues increase. So lifestyle adjustments are now essential. So if you weren't really trying to do anything, you're almost forced to at this stage, if you really want to kind of enhance your latter part of life and long-term health. So what you can do, again, is really speak with your healthcare provider and look at how the menopause transition would impact your fibroids, and explore supportive strategies that will help to mitigate and manage so that you don't have symptoms being exacerbated and stages kind of lasting longer than they should. Because ultimately, when you can support your body naturally, it will just ease everything and you will feel a lot more relaxed, as opposed to having any kind of intervention or manipulation that tends to come with the side effects and exacerbate the symptoms you've already got, and then it's just like a vicious cycle. So really get that personalized support. Now, I just want to quickly say here that when you speak with your doctor or your gynecologist, they're not going to advise you in the area of nutrition or lifestyle. So that's something to really note. They will only offer you kind of courses of medication or that kind of thing. So just know that they're not going to really be able to guide you. You would have to seek out, a nutritionist, somebody that specializes in enhancing and balancing through nutrition and supporting your body's natural processes. So hormones with the menstrual cycle obviously regulates the whole thing. It all begins and ends with the hormones like estrogen, progesterone. But what happens is we have other hormones like cortisol that play their key role in the whole disruption of things. And that's obviously linked with stress. So whatever the case is, just know that your hormones are very sensitive and they're impacted by lots of different factors. Now, again, this will impact your mood. It will impact skin. If you find that you're just breaking out, you're getting rashes, this is linked in with a hormonal imbalance, and yeah, it's being exacerbated. So this is indicators: hair loss, sudden hair loss, hair's coming out more than usual. Again, another indicator that there's something up with your hormones. And obviously, fibroids are known to rapidly grow with hormonal imbalance, and typically this is what you want to really aim to balance and support. And there's lots of variables to manage with that. I've covered key ones, but in a nutshell, diet, nutrition, lifestyle, salt levels, caffeine, alcohol, all these things will impact your hormones, sleep, how much sleep you're getting. So check all those areas. So what action step can you take? You can track your cycle and any symptoms to identify patterns and discuss those patterns with your doctor. Anything that is clearly, you can see a pattern, this will help to support you getting the resources that you need. You may have to insist for tests, hormonal tests, just to obviously see what's going on and how it could be affecting your fibroids. Interestingly, I've spoken with a few women that when they took the morning after pill, they saw significant growth with their fibroids. I'm not saying that the morning after pill causes that. Obviously, I can't say that. However, because it obviously manipulates your hormones, it's a very personal thing. This is the disruption that it can cause when you have a level of artificial manipulation and, of course, chronic manipulation through chemicals, through the food we eat, all sorts. So really guard your hormones, your body, your ecosystems with high regard, and monitor toxin exposure. Obviously, if you're taking the morning after pill, that's just a huge toxin, isn't it? Essentially. So medication is a toxin, even though it's medication. So just look at ways that you can naturally support your body, reduce toxin exposure, and eat clean. This will all support your hormones in a really positive way. So some top tips for you: use high absorbency pads or a menstrual cup. Eat iron-rich foods to prevent and reduce anemia. Um, with anemia, don't be quick to diagnose yourself. Please get it all checked, because you don't want any kind of underlying issues and you're just attributing tiredness and fatigue to anemia, because there could be so many other things. So please don't self-diagnose, and make sure you get qualified, medical advice and attention if you're feeling out of breath, shortness of breath, or tired. You can apply heating pads and drink ginger, chamomile teas. This helps to ease cramps. Castor oil packs, hot water bottles.
announce a man's business.
Oh,
He can announce a man's ministry. He can announce.
okay. Oh, where's my screen gone? Stay hydrated and rest. Make sure you don't over exercise. If you are someone that loves to exercise every day, make sure you adjust this, okay? Particularly in the lead up, maybe do more resistance, not so much cardio, and just make sure you followed all the other guidance. That's really important. Listen to your body, gentle stretches, and this will help to reduce discomfort. And once you are supplementing right, you shouldn't really feel too fatigued. I must say, when I think about my life before I changed careers because of the fibroids, and I was kind of working on health and all of that, it's remarkable the difference in regards to how I manage colds. Like before, I used to keep a cold for months. I would lose a cold, catch a cold, lose a cold, catch a cold. I always had a cold. And then suddenly I'm keeping a cold for like 4 days, 5 days, and I'm out. And I just thought, my gosh. And I saw that also with my periods now. Like I wasn't tired. Like I didn't know before. I'd be on my period and I'd be drained. I couldn't do anything. I was moody, and then suddenly it's like no difference. I can do whatever I want. So it really does make such a difference when you do be uncomfortable, make changes, try different foods, and really just take yourself out of your comfort zone in regards to diet, lifestyle, and just prioritize yourself. It can be easy to use situations to say, oh, this is why I can't do this. This is why I can't exercise. I don't have time. You have to make time, because if you don't create time for you and what you know is really important for your health, no one's going to do it for you. So you really have to learn to say no and prioritize time for you and to look after yourself. So please remember that periods are not meant to be painful. This is something that from a young age, it was like, no, this is what periods are about. But actually, I can just imagine if I had this information, I don't know, when I was 20 and I was applying all of that, it would have just saved me so much heartache, so much trauma, so much, because I would have really counteracted a lot of growth, a lot of fibroid growth and all these other things. So there is so much that you can do so that periods are not painful, and all those other issues that you might have normalized. So please don't normalize them, and seek advice, seek support to see how you can really change that. The amount of women that I've worked with that were living with pain, living with painful periods, very heavy bleeding, and now they've been able to alleviate that significantly with no medication, and it's been really life-changing. So don't accept anything contrary, to what I've said to be normal, because it absolutely isn't. Okay, thank you for listening and joining. I'm just going to check I've got any questions here. Okay. Fertility. Does ginger and lemon affect fertility when trying for a baby? As far affect fertility positively or negatively, I'll take it on both sides. In regards to positively, I would have, because it supports, it will be an anti-inflammatory impact. That's positive. I can't see how that would be negative from my understanding, but I'm not a fertility expert, but from what I know, that wouldn't negatively affect fertility. Whoever asked that question. Any more questions?
Yes, thank you so much, Nina. I joined maybe about 6 minutes later thereabout. I like the way you break down the circle, but my problem with my circle is that I can't even calculate when next I'm going to be on my period. Like, it's so bad that I don't know when I'm even ovulating. Sometimes I feel like I'm ovulating when I'm on my period, but I don't even know. I come with all sorts of moods. I'm not what's the word? I'm not fatigued, no. I kind of have energy, but it's just mood. The fact that you don't even know when this period is going to end, when the next is going to start, is just a whole lot of annoying what's it called, situation. Like, obviously before the fibroid, I could literally say I'm going to be on at this time, and then it will end at this time. But since my fibroids, it's just difficult to pinpoint when exactly you're going to menstruate and when it's going to stop. Sometimes it stops early, sometimes it stops late, really late, and you're like, what's happening? Am I still bleeding? Why am I still bleeding? Like, it's
Right.
just, yeah.
Right. Okay. Yeah, no, I hear you. Have you been able to identify kind of spotting and real bleed? Have
Yes. I have bleed, and I have spotting. And my first 6 days is hell in terms of bleeding. I'm changing pads. You were talking about pads. I don't even use always pad now. I use bamboo pads because I think they're more healthy. I use what's it called? I use I mean, yes, bamboo pads. That's what I use. I don't use always or all of those ones that I don't know their names, because bamboo pads are supposed to be better for you. And
mm,
sometimes I'm changing 4, 5 times, 6 times. In fact, when I sleep at night, I'm not even comfortable sleeping because I don't know if I'm going to get things. Like, the bleeding is terrible. It's full. Is a lot.
for
Some days I
six
just
days.
can't wait for it to be end.
Right. And for 6 days, you're
Ma-
bleeding.
no, 6 days is when I feel the most pain. But after, the period doesn't stop at 6 days. Sometimes it's 14 days. It doesn't
Wow.
stop at 6 days, yeah. Sometimes it's 14
Okay.
days, but 6 days is where the pain is very excruciating. But after 6 days, I'm fine. The pain is not so painful now. But for the
And
first 6 days, ugh, is a whole lot.
okay. And then for the following kind of 6, 7 days, is that bleed or is that spotting?
Once there's blood, that is blood. That's bleeding, right? Spotting is when it's just small, and then you're just bringing out something,
Yes,
something really small.
exactly.
Yeah, so it's not
Yeah.
spotting. There's
Okay. So
bleed, and then the last 3, 4 days is spotting.
okay. So if we take off the spotting days, how many days are you bleeding for?
So that's 14 minus maybe 3. So that's about 11.
Okay. Okay. So in regards to your issue with like how to see what's going on, first of all, with the 11 days,
Yeah.
how many months has it been like this, roughly?
Okay. So I started noticing it around October. I think October I noticed it, but November something, is it November or December? Something serious happened. Like, I just finished my menstruation, and before I knew it, I started a new one. And I'm like, what's happening here? Like, I couldn't even place it. But then when I saw the doctor, she said, oh, maybe you have a 28-day cycle. So don't count when you stop. You have to count when you start. So,
Right.
which is something I need to then, what's the word now? I need to put my eyes on. So don't count the last day you stopped. You need to count the first day you started.
Right.
So,
Okay. What I would suggest you do is
okay.
look at, you need to keep a food diary
Okay.
in regards to what you're
But I've
consuming.
been maintaining almost all the things you sent to me. Like, I've stopped dairy, I've stopped everything that you sent to me. So I've literally just been following all the things you recommended: red lentils, what's it called, chickpeas. Those are things I'm eating now. Almost
Yeah.
all my diet is now plant, really.
Okay.
Brown rice, those are things I eat now. So I was hoping that at least but then maybe things don't happen quickly. So I was hoping that this January I'd have seen a bit of a change, but
Mm.
no, I've not noticed that.
And what supplements are you taking?
Currently I have this iron, supplement I was taking, because when I went, they said my iron was a bit low. Then I'm taking an immunity. There's this immunity supplements, vitamin C and something. There's magnesium glycinate, and there's a couple of things in that immunity capsule. I can't find it right now, but when I find it, I'll send it to you. The combination.
Okay. The reason why I asked about the supplement, how long have you been following the plan I sent you?
Oh, the moment you sent it to me. So that would be about late December.
December. Okay. And we're still in January.
Yeah,
So
we're still in January. Yeah.
okay. Okay. So with this time, that has the time lapse, obviously that's not significant enough.
Yeah.
And then when you factor in the absence of kind
Sorry,
of,
I forgot to tell you, I've noticed a lot of gas. I don't know, like I have a lot of gas, maybe bloating, but I don't know what exactly is causing it. And I don't think maybe corn is part, because I noticed I ate something like corn yesterday, and throughout yesterday, literally I was just feeling very full, bloated. And then literally I've noticed that I release a lot of gas, like it's unbelievable.
right. Yeah, that could be down to a number of things. And it was going to be when I was just trying to talk about the approach with the food. What
Okay.
you do is keep a diary. And
Okay,
for
baby.
example, if you feel gassy, then you will be able to note what foods you ate. Because
Okay.
sometimes if you have too many cruciferous vegetables, that can cause quite a bit of gas.
Oh,
And
really? Because I always take greens early in the morning, because I just think it's really good. So I take a combination of green blends, chlorella, spirulina, apple, cucumber, and kiwi. So
yeah,
I blend all of that together and take that
yeah.
in the morning.
So what I'm so with the so do you eat broccoli or
Yeah, I do. I eat broccoli.
yeah, so that's something that you need to limit, because sometimes we think, oh, it's good for us, so I'll eat a lot. But then if you eat too much, depending on what you've combined it with, that can cause you to be more
Okay.
gassy. So when
Okay.
days that you're feeling more gassy, you can look at, okay, that day I ate this. So it's a way that you wouldn't, obviously you would think that, okay, this is what I ate, but you kind of look at it more over the month
Okay.
and then when you can see a pattern that, oh, every time I'm eating this, I feel gassy, then you know that, okay, it's a combination of this and these foods. And then once you take them out, obviously see. So you do have to get quite detailed with what you're having, quantities and combinations. But this is
Okay.
the only way to identify what's causing you to feel more gassy.
Okay.
So like, for example, when I felt very I had pain, like I felt pain and I felt very uncomfortable in regards to my intestines and digestive area. And I was able to work out that the protein shake that I was getting at the gym had dairy in it. It had wheat, even though they were telling me it was pea based. I was able to work out that it wasn't, and that was how I isolated that, because I was literally feeling pain a day after I was going to the gym, and then I
Wow.
thought, what am I doing different? Oh, I'm having the protein shake at the gym. So and that was where I picked it up. Do you see? And I was able to go back and have a chat with them, and they kind of embarrassedly shared that they don't really check which ones they mix or whatever.
Okay.
So that's how I done it.
Okay.
I saw the pattern of how it was happening and what I was doing, and on that particular day that was different from the days that I wasn't having the pain.
Okay.
Yeah. Um, and then going back to supplements, with the plan that I sent you, it's really important that you're having key supplements that I recommend. And the reason why I tell you why is because you've had a significant reduction in animal protein.
Yeah.
You have to make sure that's being replenished
Oh.
in a
Okay.
very strategic way. So,
Okay.
um, for example, like one of my clients, she started on the plan and she noted that she just feels so much more energized, like just so many positive things. But if she'd have followed that plan without the supplements,
Nement. Okay.
she would not be feeling like that. It's
Okay.
been, it can work in isolation if we really go over what you're taking. So I think maybe if we can schedule a meeting and I can actually understand what times you're taking and what you're taking, and then
Okay, that's fine.
say
Okay.
that won't work, or this is what you need to add at least to make sure your body's getting what it needs for the,
Yeah,
because if you're
that's fine because I'm really worried about my menstrual cycle. Like it's giving me a lot of headache.
yeah, and just curious, when you compare it to 6 months ago, what was happening 6 months ago before you've changed your diet or anything?
I can say that the blood is not as much as that, but I'm still bleeding. It's just that the bleeding in terms of the flow now has reduced a bit compared to 6 months ago. And then the big what's it called now, clot that I used to see, then the clot is not as much.
Okay, so there is an improvement somehow.
Yeah, there is improvement. It's just me not being able to tell because when you're going to be on your period, it helps you prepare. It helps okay, I'm going to start my period, so this is what I need to do. Okay, so
Yeah.
this is what I need to stop doing, this is what I need to increase. So it helps you, and that's what I want to know. And then you need to know when you're ovulating, all of that. So that's what it is.
Yeah, sure. And are you also trying to conceive, or is that?
Absolutely, my husband can't wait for us to be pregnant, but we need fibroid. We need fibroids to be a thing of the past first, because it's not helping us do anything.
Yeah. Okay. Yeah. You've got. Just send me a message now somewhere, and then I'll send you a link to.
Okay.
We
Okay.
can go over
Okay.
your
That
supplement
works.
plan.
Thank you
Yeah.
very much.
You're welcome. Thanks for
Thank
your
you.
question.
Thank you. Thank you. Sorry everyone for taking your time.
I think
Sorry.
sure they would have learned a few things or something.
Okay.
I'm sure it's fine. Okay. Someone said if you're trying for a baby, you should avoid ginger and lemon because they are acidic. Yeah. Well, the thing is with anything like lemon, it's how you have it, and I've never told anyone to have lemon on an empty stomach. So it's like doing things like that, having lemon on an empty stomach is not ideal, So it's not particularly that ginger and lemon is you shouldn't consume it if you're trying for a baby, but it's how you consume it, um, and the quantities. So I've not heard of that, but definitely yes, lemon can cause issues if you're having it in the wrong way at the wrong times, and it can cause some imbalances in regards to digestion. So that's what I would have thought when you're having it and what you're combining with the lemon. Okay, Grace, no one can see your messages because I know you're saying thank you to Aminat, but you're sending the message directly to me. Just so you know, you need to send it to everyone. Change your setting. But Aminat, Grace said thank you for your question. Any other questions? No questions. Okay, all right then. So I'll go ahead. Oh, it's been an hour. Thank you for joining. And no worries, Grace. Thanks for joining. And yeah, share this. I'm gonna put the recording on my YouTube. So if you know anyone that would benefit, feel free to share with them. You're welcome, Mayal. I hope you're well. Thank you for joining. Oh, lovely. Thanks, Andy. I'm glad you got value. Have a lovely evening. It's always nice to see you. Andy is one of my past clients and she's just done incredibly well. She's shrunk her fibroids to pea size. She's doing so well. She's so consistent with her supplements. She's literally just placed an order with me now. And yeah, it's just really about getting that your own routine that you really work, you know is your power routine. And when you're not in it, you can feel the difference. So, you know, we're going to work on something, Amina, and yeah, just reach out to me and we'll create something for you as well. Thanks for joining, ladies. Have a lovely evening and take care. Bye.